the station that's on your side. This is Channel 7 News Daybreak.
Welcome back. More than 12,000 women in the United States will be diagnosed with cervical cancer this year, and statistics say that more than 4,000 of those women will die. Cervical cancer is the second most common type of cancer for women worldwide. Dr. Laura Lester from Baptist Health Family Clinic Malvern is here to talk a little more about it. Good morning to you.
Morning.
Thanks so much for being here. First off, let's talk about what is exactly cervical cancer.
It's the most preventable gynecological cancer. You can get cancer of anything, your cervix, your uterus, things like that. But the cervix we can actually test for, and early detection is key in prevention and treatment. And it's very treatable, it's preventable, it's just about screening.
You have to be proactive.
Have to be proactive.
And going to your doctor. What are the symptoms of cervical cancer?
So, a lot of times you have no symptoms. The early stages you don't have a lot of symptoms, which is the scary part. The late stages you can have, the same normal general things, abnormal bleeding and discharge and things like that. But at that point, something's going on, and you should really have gotten it checked out. It takes a while for cervical cancer to really progress, which is why the screening for pap smears they've spread them out. So it's only 3 years for pap smears. And the HPV testing has increased that to, if you have a negative pap smear and negative HPV, then you can go sometimes up to 5 years if you're symptom free.
But you've got to go for that initial
You've
one.
got to go. You've got to get. We really like you to have 3 negative ones without symptoms, without anything changing. And then we feel really good about that.
What are your risk factors for developing cervical cancer?
A lot of people don't realize that smoking is a risk factor. Obviously, unprotected intercourse, you got to be careful. Men are transmitters of the HPV virus, which is the major cause of cervical cancer. So, they can carry it. They don't have symptoms at all, ever, because they don't have a cervix. So, you have to really be careful and protect yourself and be proactive.
When should you get that first initial screening? What is
21
the right age?
is now the new age, which is a newer update. Usually, well, in past years they said whenever you became sexually active, but now, because it's such a slow, progressive thing, age 21 is when we start doing the pap smears, and age 30 is when we start doing the HPV testing.
And prevention is key here.
Yes.
What are some things that we as women need to be doing?
The annual checkups, and if you need a pap smear every year, you get one, but hopefully you don't need one every year. Now that we have immunizations for HPV for the 4 main strains that cause cervical cancer, and that's available from age 9 to age 26, and that's boys and girls. So the men can get vaccinated to where they will not transmit, and the girls can get vaccinated to where they're immune.
The importance is seeing your doctor, talking to your doctor about all of this. A pap smear is never something any woman looks forward to.
Nobody likes doing it. Nobody likes having it. But it's 5 minutes, and then you have such peace of mind, and it really is.
It could save your life.
Oh, absolutely.
Dr. Laura Lester, as always, thanks so much for being here. Here is the Baptist Health Helpline. If you have any questions, it's 1-888-BAPTIST.